All right, let's talk about something super important. If you or someone you care about is getting ready for surgery, I want you to think of this as your personal playbook. We're going to walk through the simple but really powerful steps you can take to team up with your doctors and make sure everything goes as smooth as possible. So let's jump right in.
So let me just kick things off with a big question. What do you think is the single most important thing you can do before you even set foot in the hospital? You might actually be surprised by how much control you have in setting yourself up for success. Your role here is absolutely crucial. Every great game plan starts with one thing: knowing your opponent. And in this case, our focus is on preventing a specific, kind of unseen risk that can pop up after any operation. And that opponent is called a surgical site infection, or SSI for short. It's pretty much what it sounds like, an infection that shows up right where the surgery happened. Now, the key thing to get here is that stopping an SSI isn't just on the surgeon. Nope, it's a total team effort, and you are a star player on that team.
So your active role, it starts way before you even check in. Let's dig into the pre-hospital game plan. These are the critical moves you can make from the comfort of your own home.
Okay, so there are two huge plays you can run before the big day. First, it's about getting your own health in the best shape possible. And second, well, the second one is a surprisingly simple step that makes a massive difference.
This first play is all about prep work. So if you've got other health conditions, like diabetes or high blood pressure, working with your doctor to get those under control before the surgery is planned is one of the most effective things you can do. It just makes sense, right? A healthier body going into an operation is way better at fighting off infection. And here it is, that simple but incredibly powerful step. The night before your surgery, just taking a good, thorough shower or a bath helps get bacteria off your skin. This drastically lowers the chances of any of those germs making their way into the surgical site. It's an easy win, and it's one you have complete control over.
All right, pre-game prep is officially done. Now, it's game day. Let's talk about what happens when you get to the hospital, because there are some really smart moves to make here, too.
So, the next two plays happen on-site. The first is about timing your arrival, and the second is about making sure any hair removal is done the right way, and just as important, not the wrong way.
Now, this might sound a little strange, but you actually don't want to be hanging around the hospital for hours and hours before your procedure. The goal is simple: minimize your exposure to any hospital germs. A shorter pre-op stay is just a safer pre-op stay.
Okay, this is a big one, so pay close attention. When it comes to hair removal, there's a definite avoid here: shaving with a razor. Why? Well, it can create these tiny invisible cuts in your skin, perfect little hiding spots for bacteria. The gold standard, if hair absolutely has to be removed, is sterile clippers, so don't ever be afraid to ask, hey, are you using clippers for that?
We've covered what you can do at home and what to look out for at the hospital. Now, let's talk about that final, powerful layer of defense your medical team will provide. Think of it as an antibiotic safety shield.
But here's the catch with this shield. It's not just about getting an antibiotic. For it to really work, the timing has to be absolutely perfect. So, what is that critical window for protection?
And this timeline lays it out perfectly. For most standard antibiotics, they need to be in your system within 1 hour before that first incision is made. For some others, like vancomycin, that window is 2 hours. This timing ensures the medicine is at its peak power right when you need it most. And just as important, you see how the shield usually comes down after 24 hours? That's to prevent other issues.
So there you have it. We've gone through all the plays, from what you do at home to the strategy at the hospital. Now let's bring it all together and review your complete patient safety playbook. Okay, let's recap your 5 key plays. Number 1, manage your health risks. 2, take that all-important shower the night before. 3, keep your hospital stay before surgery short and sweet. 4, say no to razors and yes to clippers. And 5, don't hesitate to confirm the timing of your antibiotic shield. Just ask your nurse, am I all set with my antibiotic for surgery? These 5 steps put you right in the driver's seat of your own safety team.
At the end of the day, your health truly is a team sport. And by knowing this playbook, you're not just some fan in the stands. You are prepared, you are empowered, and you are absolutely ready to be your own MVP.